The views and opinions expressed during this program are those of the hosts, guests, and callers and are not necessarily those of this station, its management, or other employees, advertisers, or sponsors.
Good morning. It is Wednesday, September 3rd. I'm Michelle Dials, and you're listening to Talk of the Town on 1230 WSAL. Joining me this morning from Logansport Memorial Hospital, Carmen Danhauser is here. Good morning.
Good morning, Michelle. How are you?
I'm doing well. How are you?
I'm well and good, thank you.
Well and good. That's nice.
I'm the marketing girl. I have to get the plug in there, you know.
Yes, and we haven't talked to you for a while. Usually Vicki is in, but
Right.
You're taking her place today.
Yes.
So normally I let her introduce the guest that she's brought with her. So would you like to introduce your guest this morning?
Absolutely. I have a great guest with me this morning. We have brought Dr. Francois Fidel with us this morning. He is our new pulmonologist at Logansport Memorial Hospital, and pulmonology is a new service line for us. So I'm going to let him share a little bit more about what he does and why that's so beneficial for our community.
All right. Good morning, Dr. Fidel.
Good morning, Michelle.
It's nice to have
Carmen.
you. Nice to have you here with us this morning,
you.
and nice to have you in our community.
Thank you very much.
How long have you been in Logansport?
It's been almost 3 months now. I moved back in May and started working at the hospital in June. Have been active clinically working at the hospital since mid-June.
And so let's start with what pulmonology is.
Okay. Pulmonology is a specialty related to internal medicine that focus on respiratory and lung problems. Respiratory issues are either the upper airways or the lower airways. So we're talking about the lungs, but also we're talking about the windpipe, vocal cords problems, etc. And it does also have close relation with the critical care settings, as we also treat patients in the intensive care units, mainly those who are on the ventilators or in respiratory failure.
Okay. So what's your background? What's your training? How'd you get into this?
All right. So I initially, when I was in high school, I had a lot of focus on biology and interest in medicine overall. I did medical school at St. Joseph's University. It's a private European school, and then moved for my training after that to New York. I started internal medicine residency in New York City at Staten Island Hospital, which is part of the North Shore LIJ Health System, and then while in internal medicine, I was really interested in the pulmonary and critical care specialties. Did apply for that and pursued a fellowship as well in New York City with a double training in pulmonary and critical care medicine, leading to a certification in both specialties. And that was at the State University of New York at the Health Science Center at Brooklyn.
So a little bit of a culture shock coming from there to here.
It's a little bit of change, but initially I was used to small towns, and I'm happy to be back in a small community. You feel that you're close to people and that you're able to help them.
So are you from Europe?
Well, my background is a Maronite. That's the ethnic background, so it's kind of the Christian minorities from the Mediterranean areas. I was raised in France, did medical school there, did some certifications and training as well in Belgium and Luxembourg. And then moved to the U.S., as I mentioned, in 2007.
Wow. Very impressive.
Thanks.
So, Carmen, you said that this is a new service line for the hospital, and obviously that would probably come out of the things that we've talked about on this program before about the needs of the community as far as service lines.
Yes, definitely with the recent completion of our community health needs assessment, that identified several areas where our community needed care and different things, and we have several priorities that were established from those findings, but really pulmonology addresses several of them. It's a service line that really has kind of spoken to some of the data we were surprised to find out of that community needs assessment. And I know I've shared those findings with Dr. Fidel. He's seen them. He knew a little bit about what the community was like, and he can talk a little more about that. But that's why a big reason of why he's here is to see some of those patients and help make that difference. So
So what have you seen in the 3 months that you've been here?
Yeah, so I was initially when I applied for the job in here, I knew that Indiana is one of the states where smoking is really prevalent, and it has actually always been ranked in the top 3 with the highest smoking rates in the nation, along with Kentucky and West Virginia, I guess. So I knew that there is probably a lot of respiratory diseases related to smoking itself, and consequently, me being able to help through my pulmonary specialties, those patients who are smokers or who have diseases related to smoking might be a plus to the hospital as well. So I've seen a lot of cases, mainly emphysema and COPD, which is the direct consequence of years and years of smoking. And I've seen some cases that are pretty advanced. In 3 months' time, seeing so many cases that are advanced and in need almost of a referral for a lung transplant was kind of interesting. And we're hoping that we can help further in the future on that.
That's scary.
Well, it is. Well, smoking by itself, as you know, is very toxic. It causes a lot of damage to the airways and to the lungs. And COPD is just one part of what smoking could. How smoking could hurt the lungs. We would like to mention as well about lung cancer itself, and the mortality and the care in there, and how this is related to our county and here and to Indiana in general.
What are some of the symptoms that would bring people to see you?
Okay. So overall, again, talking about pulmonary, it's an outpatient service as well as an inpatient service. The inpatient part, as I mentioned, is a critical care part where anybody who's in need of intensive care unit care, such as ventilators, respiratory failure, as we mentioned, pneumonias that are severe enough to be admitted to the intensive care unit, but as well other problems related to critical care in general, uncontrolled diabetes causing dehydration, GI bleeding. There's strokes that are massive to a point that they need the intensive care unit. All these services were able to help at the inpatient side. Now, for the outpatient, the clinic, as we mentioned, it's mostly the respiratory diseases. Smoking by itself leads. If it's extensive, it leads to cough and wheezing, and these are the symptoms that would point to COPD, in which case early care might be able to help most of those patients, in order to prevent further damage and further loss of lung function.
So when you say that somebody's getting to the point where they might need a lung transplant, is it something they've just overlooked over the years?
Absolutely, yes. It starts with a coughing and wheezing, and definitely there you would think that there is some lung damage, and there is a lot that we can offer to prevent further damage. Getting to a point where the lung function has been so low, we're talking about percentage on the pulmonary function tests, which are the tests that we're on, and reaching 20% of their lung function is pretty advanced. It means that they've been having problems for years and years and years, either haven't been, seeing physicians or caring about themselves or continuing to smoke, and reaching a level where, 20% you would need to refer them for lung transplant is pretty advanced.
Yeah. Wow. That's a statistic that it's hard to wrap your head around. I mean, it really
Correct.
is.
Mm-hmm.
And you touched on, obviously, lung cancer being a major issue, and I know I've heard lots of stories from people who it's a fast-moving cancer.
It is. Lung cancer is a big problem. And lung cancer is a number one killer in the United States. The mortality rate related to lung cancer equals the one related to breast cancer, colon cancer, and prostate cancer all combined. So it's a number one in mortality, and a lot needs to be done to improve survival and to improve care in that sense. The problem with lung cancer is that if it's catched late, it's pretty advanced, cure is very hard to achieve. So that's why early care, if there is any symptoms, seeing the pulmonologist, having appropriate tests such as chest x-rays done or a CT chest, catching early spots in the lungs, following up on those spots to see if they're going to grow, and treatment when appropriate would prevent these cancers from spreading and reaching a level where they cannot be cured. I want to mention here, Michelle, in the healthcare assessment report for our county, there was statistics about cancer mortality in general, about lung cancer in general. I want to mention that the cancer mortality for our county is higher than Indiana in general, and higher than the average for the United States. And Indiana by itself is also higher than the average for the United States, and that could be related to smoking, as we said, is pretty prevalent. And then if we talk about lung cancer specifically, and we see the annual average deaths between 2008 and 2010, and that's per 100,000 population, it reached an alarming number of 74.4 death per 100,000, while the average for Indiana is 59.9, and the average in the United States is 48.5. So we're almost double what the mortality rates averages for the nation, and that's points to the need for further care in that sense.
So, what do you tell your patients?
So I want to say that first and foremost, very important to have counseling about smoking cessation and the risks of smoking by itself on their lungs and their health in general. The second is anybody who has symptoms, even minor, of coughing and wheezing, appropriate care and again seeing a pulmonologist is advisable, because through breathing tests and through treatments with inhalers and assessment, we would be able to help them to prevent further loss of lung function, to prevent them from getting worse and worse with time, and to prevent possible spots in the lungs that could evolve into cancer and might at some point, as I mentioned, increase mortalities and become incurable.
Now, is your practice referral based? Like they would get a referral from a primary care physician?
It is a referral based. However, we accept patients who would like to refer themselves. We do work with their primary care physicians to help get the referrals. So we're open if anybody have symptoms and would like to be referred to us. They're more than welcome to call my office, and we'll do the appropriate. We'll contact the primary care physicians to get the appropriate referrals for them.
Now, obviously, smoking is a huge part of it, but are there other diseases that you see or cases that you see from people who don't smoke? I mean, are allergies, asthma, that sort of thing prevalent?
Right, absolutely. So asthma is another prevalent disease in the state in general and in the United States. And the increase in prevalence of asthma overall over the last couple of decades is probably related to the environmental pollution and to other factors that we're facing. Asthma is a disease that is treatable, as mentioned. However, it needs care and needs close follow-up. So patients who have symptoms as well goes in the same line, shortness of breath, coughing, and wheezing, and they're not smokers. They probably have signs of asthma, and early care would prevent further damage and loss of lung function, and getting to a point where the asthma is uncontrolled and causing them really trouble in their daily life, daily activities.
Now, I know that things like that sometimes tend to pick up seasonally as well. So is fall a big time where you see a lot of people?
True, yes. Fall and the winter season is mostly related to the flu viruses and to other types of respiratory infections that we see in general. The problem with COPD patients, asthma patients in general, and other lung diseases is that someone who has normal lungs and gets an infection, whether it's a flu or a pneumonia, they kind of it's easy for them to clear it over a couple of days. Someone who has already damaged lungs from and with damaged airways, inflammation in the lungs from smoking or from asthma itself, it's harder for them to clear those infections. And so proper care, proper vaccinations, mainly the influenza, the flu vaccine and the pneumonia vaccine, would help prevent those problems, as well as close follow-up through taking their inhalers and being managed appropriately would help as well improve their care.
Now, as far as pneumonia, I've seen a lot of things also from people who are diagnosed with pneumonia, and it doesn't seem like there's anything wrong with them. Or they've had a cough or that sort of thing, and then all of a sudden I've got pneumonia, and it just seems like that's sometimes kind of a shock. So is that something that you see a lot of as well?
We do see pneumonia is as I mentioned, is very prevalent in the winter season. Most of the pneumonia starts as a simple viral infection, like indeed the influenza virus, and then it evolves into a superimposed bacterial infection, which what we call pneumonia, lobar pneumonia. And you have also atypical pneumonias, which we call walking pneumonia. It's someone who's in the community, doesn't have any underlying respiratory problems, and do get infections, mainly again in the winter. Through the healthcare assessment needs for our county in general and for our community. I was looking at the numbers again for the pneumonia mortality numbers from 2008 to 2010, and the annual average deaths per 100,000 population, the Cass County is 30.3. compared to 17.9 in Indiana and 16.4 in the United States in general. So we're almost double mortality rates in our county compared to the United States average mortality rates. This could be related to multiple factors. First, as I mentioned, COPD and asthma is a very prevalent disease, and a proper care would prevent complications of pneumonia, including mortality. The second thing is that pneumonia is a disease where it's important to give the antibiotics as soon as possible. Anytime we see patients, whether they're in the emergency room or have severe pneumonia to a point that they need to be admitted to the intensive care unit, giving the antibiotics within 1 to 4 hours of their symptoms or their arrival to the hospital is very important, or even their visit to the clinic, because it will prevent further spread of the infection and further damage and unfortunately high mortality rates that we've been seeing.
This is really fascinating information. I mean, there's obviously a need for the service that you provide. The numbers that you provide are just staggering. Mm-hmm. Are there things that we haven't, I think we could probably talk for another hour about this, but our time is about wrapping up. Are there things we haven't touched on this morning that you would like to make sure that the public is aware of, Dr. Fidel?
Sure. I wanted to say that the lung, the COPD by itself, and lung diseases in general, in the past, in statistics of the most prevalent diseases that we face in the United States in general, and the one that causes mortalities in general, we always spoke about cardiovascular diseases and as number one, number two, cancers, and before 2011, number three used to be stroke. And number four used to be respiratory problems. And I want to say that since 2011, the respiratory diseases, including COPD, has become number three, which points again to the need for better care, the need for better counseling over smoking cessation, and the need to improve the quality of life and the survival of patients who have respiratory problems. I want to touch base again about one last point that is important as well as a risk factor for lung diseases that we face as well in Indiana in general, and that's radon. Radon is a nuclear gas that you can't see and you can't smell, and is pretty prevalent in the state overall. It's a second leading cause of lung cancer in the nation. True, we have to focus a lot on smoking itself as a major cause of lung cancer, but a lot of patients that did have lung cancer, but they never smoked in their life, this is very possibly connected to the radon. And so, care of patients who have lung symptoms, not only if they're smoking, but also if they're never smoked, should make them think that it's important to see a physician, to get a chest x-ray to make sure there's no abnormal spots in the lungs. Otherwise, as I mentioned, you let this go a couple of years, cancer spread, and it becomes incurable, and this is what we're seeing here in our county.
So if someone is interested in talking more with your office about anything that we've discussed today, they can just make a direct call to your office?
They're more than welcome to do so, and we'll be happy to help them. Again, some patients won't need a referral to see if specialists. Some would need, and even those who are in need of a referral, will be happy to help them and contacting their primary care physicians ourselves to get the appropriate referrals for that.
Okay. Anything else you want to share before we wrap up this morning?
No, I want to just say that I'm happy to be here in Logansport and happy to serve this community. My family and I moved 3 or 4 months ago, and we really feel that we're part of the community, and we're looking forward to raise our family in here and, to help as much as we can, improving quality of care and providing this line of service that is new to the community in general and to our hospital as well.
What would you like to see a year from now?
Well, I would like to see in a year or 2 years some change in the statistics that I just mentioned. I would like to see that patients are being able to quit smoking earlier, that they're being cared for their COPD and their lung problems appropriately, and to see the numbers decreasing, mainly, the mortality rates, which we don't like to see usually. We want to help them, and we want to do that with the best quality that we can offer to them.
Well, welcome again to our community. It sounds like it's definitely a service that is much needed. So thank you for sharing all of that with us this morning.
Thank you very much, Michelle. Thank you.
Carmen, any events coming up that you want to share before we wrap up today?
We will, Michelle. We have a couple. I'd be remiss, first of all, if I did not mention our upcoming MUM sale for the Volunteer Auxiliary. This is a fundraiser they've put on the past couple of years, and it is Tuesday, September 9th. Starting at 8 a.m., we'll have a variety of 8-inch mums in different colors available at the front entrance towards the lobby of the hospital, starting at 8 a.m., and they're going until they sell out. So hopefully we sell out quickly, and the mums are $5 a piece. And then the other event in September coming up, the hospital is not directly sponsoring, but really involved with and part of, is the Live Well Health Expo, as you know, coming up for United Way. We're really excited about the demonstrations and the activities that we'll have that day. And so that's, of course, Saturday, September 20th, and LMH is ready to live united. So we're excited about that.
And I believe we have some representatives from that event coming in later this month to
Awesome.
share more info.
Great.
So looking forward to hearing more about that.
Absolutely.
All right. And then we'll talk to you guys again next month.
Can't wait. Breast cancer awareness coming up next.
All right. Sounds good.
Thank you.
Carmen Danhauser and Dr. Francois Fidel with Logansport Memorial Hospital. Thank you guys so much.
Thanks, Michelle. We appreciate it.
That'll do it for us for this half of Talk of the Town. We'll be back with more.